Hey doc, I'm Dr. Jeff Langmaid with the Evidence-Based Chiropractor. And today I want to talk about how to send case notes to MDs. This is one of the most confusing aspects for so many chiropractors out there about relationship building. You know you need to communicate with these doctors to get something going, but you have no idea how to do it. Or maybe you're somebody who sent a case note in the past and didn't know what to put on it, felt as though you didn't get anything back from it, or they were so hard to get shipped out your front door because they were so long and complex that you gave up on it. Probably a combination of all of those things. So today, let's talk about how to send case notes to MDs that help you build referral relationships with other healthcare providers that is super fast, super simple, and super effective. It all starts with when do you send these things? When you have a case note, I want you to also differentiate. A case note is not an insurance note. So what you send to an insurance company for reimbursement is not the same thing that you send to other healthcare providers or MDs in your community to build referral relationships. Sending case notes, the cadence of them should be whenever you do an eval or a re-eval. So you do not need to send daily notes by any stretch of the imagination, but anytime you're doing an examination or an evaluation on a patient in your practice and you have the healthcare information of other providers, you want to ensure with patient consent that you're sending over that case note. So your cadence, evals and re-evals, it is not daily. Second part about this, what do you put on a case note? You do not put every single item that you do. What you want to identify is who's the patient, when did you see them, what did you find, what are you going to do about it? In medical and healthcare terms, that's patient name, date of service, diagnosis, and treatment plan. Patient name, date of service, diagnosis, and treatment plan. Who did you see? When did you see him? What did you find? And what are you gonna do? I always use the example. Primary care physician doesn't care what size screw a surgeon uses if a spine fusion is performed. They care whether the procedure was performed. And the same goes for your practice. Don't get so myopic and nitty-gritty on every orthopedic test, every single maneuver that you did. Keep it high level, and believe me, if that doc wants more information, they will reach out, but you do not need to punish everybody else in the process. So how do you send case notes? When do you send case notes? You send them during your evals and your re-evals. Keep it simple. So identify those 4 big items you want to have on that case note: patient name, date of service, diagnosis, treatment plan. Don't overdo it. By not overdoing it, it makes it so much easier to get it shipped out the door. Now, all of our members of the Evidence-Based Chiropractor, we have reports, templates, and guides that show exactly, fill in the blanks, how do you send an awesome case note that builds referral relationships. And remember, case notes are the first pillar of building referral relationships. So we talk about case notes, research, and meetings. We're gonna have other videos coming up diving into research and meetings. This has been about case notes. If you have any questions, drop them down below. If you would like to join the hundreds of chiropractors who have generated tens of thousands of referrals from other healthcare providers using a proven, easy to follow system, visit us at theevidencebasedchiropractor.com. Hey, what's going on? If you loved that video, be sure to subscribe to this channel. The Evidence-Based Chiropractor puts out videos all the time at the intersection of marketing and research, showing you how to grow your practice while also growing your knowledge base. So if you liked it, be sure to comment down below or hit subscribe, and I'll see you in the next video.